Welcome to Navigating and Supporting the Mental Health Needs of People Living with HIV and AIDS. My name is Paredes. I'm a licensed marriage and family therapist, and this topic is near and dear to my heart. So I grew up in San Francisco and was often involved in building community and community treatment options for those living with these different conditions. And so hopefully you get something out of this presentation and it becomes a little more meaningful to you as well. So why does this matter? It's a chronic, manageable medical condition, and the mental and emotional burden is often very high and very overlooked, unfortunately. And what does it mean? So a lot of folks, we hear these terms HIV and AIDS, but we don't necessarily, think too deeply, understand what is meant by it. So HIV is the human immunodeficiency virus, and it's a virus that affects the immune system. And with treatment, people can live long, healthy lives. And then when it morphs into AIDS, it's a preventable late stage condition. And some folks have HIV and it never turns into AIDS or develops into AIDS, but often that's the trajectory that we are accustomed to discussing when we talk about the higher cost of the mental health piece, unfortunately. So there's typically, when we talk about HIV and AIDS, higher rates of depression, anxiety, trauma, adjustment stress, substance use, all understandable. This is a huge life event, huge trauma. And it's important to note that these are not caused by the virus, but by stigma, life disruption, social and systemic barriers, the adjustment piece of it all. We can go into tons of trauma around that, but for the purpose of this, we'll keep it to this list. So there's myths versus fact. I think there's a lot of stigma, a lot of misinformation out there. So a lot of folks think there's this idea that HIV and AIDS are the same. They indeed are not. So HIV is a virus and AIDS is a preventable late stage condition related to or as a result of HIV. Myth is that HIV defines who someone is. Not true. It's not the identity. People with HIV, another myth, are always very sick. Again, not the case luckily anymore. So the fact is that many feel healthy and live full lives when medical attention is sought and received. And it matters because myths increase shame, isolation, and avoidance of care, right? So if we don't feel heard, we don't get the care we need. Common mental health stressors, stigma, fear, judgment, disclosure stress, who can we tell, who is it safe to tell, medical trauma, chronic monitoring, that's just a whole level of trauma in and of itself, facing housing, unemployment, and financial instability due to the medical needs, and identity threat. So this is all people see in me. They don't see me for who I am anymore. What support means for the mental health of folks is feeling safe, believed, and respected, control over disclosure and their own decision making, consistent, predictable support. This is huge when it comes to family members and friends. An identity anchored beyond the diagnosis. So the diagnosis, again, is not who they are. It's part of what makes them who they are, but not their entire identity. And connection to peers and community to be able to feel seen and heard. How to support it, again, using person first language. It's a person living with a condition. It is not the person. Letting them set the pace of disclosure. You can't force anybody to share anything with you or with others. Offering choices instead of directives. Hey, how can I support you? Is this helpful? Is this helpful? Being consistent and reliable, just showing up reliably is huge. And listening without fixing or minimizing, right? So at least it's not ... is not very helpful, but just staying steady and not solving problems, but just being really present with folks can be very helpful. So how family and friends can help: lead with love, not fear. Hey, I'm here for you. I love you. Let's figure this out together. Let them, control who knows. You get to decide. I won't be telling anybody. That's your business to share. Let me hear you. Listen more than advise, right? So we want to be able to just be really present and mindful around hearing someone who needs, that extra level of support, and then you can offer practical help. Is it helpful for me to help you make appointments? Is it helpful for me to give you some resources? What does that look like? And communication tools that reduces harm. We, don't think too much of our language in our day-to-day lives necessarily, but it really matters. So thank you for trusting me with this. Is huge, often genuine, hopefully genuine, but often overlooked. You're in control of who knows. You don't have to figure this out by yourself. I'm here with you. And the diagnosis doesn't define you. It's part of the journey. It's not who you are. And avoid assumptions, avoid over reassurance. And curiosity can feel intrusive if you're asking too many questions and really overstepping your bounds, right? So you just want to be mindful of that and encouraging, some mental health support is huge. So a lot of folks just see the diagnosis as a medical condition. Family and friends may not consider the mental health factors. So encourage a referral if you notice that someone is struggling with loss of daily functioning, depression or anxiety symptoms, their trauma symptoms are interfering with their own care, right? When depression escalates, you're unable to maybe shower, take care of yourself, not eating. Medication non adherence can tie to distress. You always want to help folks if they're not able to take medication on time or regularly. And of course, if anyone ever expresses to you hopelessness or suicidal ideation, you want to encourage them to seek referral or seek help. And key takeaways, mental health distress is often stigma driven, unfortunately. It's not virus driven. So feeling afraid to share, afraid to seek help is often just the stigma. It has nothing to do with the available resources anymore. Trust, consistency, and dignity are really powerful interventions. Supporting autonomy protects mental health of those struggling with these challenges, and small affirming interactions that are positive and reliable make a huge difference. So care with dignity, listen for resilience, and support with consistency are all so important and so effective. Here are some additional resources for the Contra Costa Health Department and Mental Health Services, different community resources for you as well. This is my contact if you have any questions or concerns or would like additional resources as well. I'm available. Please don't hesitate to reach out, and thank you so much for listening and watching that brief presentation.